The energy poverty is actually one of the drivers of this huge emissions because of the energy efficiency of the device, because of the low income, and because of the high share of energy costs in total expenditures. For all these reasons, people turn to different coping strategies, which result in inefficient energy consumption and huge emissions.
Stroke, myocardial infarction, chronic diseases of respiratory system. And for this, we have some numbers, we can quantify it, but air pollution is also affecting many systems, affecting our metabolic functions. There is now emerging evidence of air pollution affecting our nervous system. So indeed, the health argument is central here.
The children with lower economic status are highly impacted. Children in rural areas, children living in southern and eastern Serbia, and in Šumadija and western Serbia, children living in Roma settlements, children without access to electricity. They are few, but some households still don't have access to electricity, and child migrants living in temporary settlements.
We should not forget that a good chunk of the population in certain cities will simply not be able to benefit from these different schemes and investments.
Introducing technical solutions such as improvements in the mandatory building codes for energy efficiency, energy saving, improvements in the heating, ventilation, air conditioning standards and labeling, as well as improvements in the insulation of windows, rooftops, maintenance of the existing heating equipments, efficient solid fuels. These will be critical.
Of course, we need to focus a lot of our attention in how buildings are built, the insulation they have, the type of windows, the insulation on the roofs, the floors, the walls, etc. And a lot of work can be done and tackled there, and a good and solid program on retrofitting buildings, both public and as well as private, could be something very much hands-on that could also be done in a coordinated and programmatic way.
The importance of the human rights-based approach is that it tells us to tackle these issues through the lens of human rights. It means equality and non-discrimination, looking at the right to participation and access to information. Specifically in this case, non-discrimination means that the people who are worst affected by air pollution is actually those that are already in a vulnerable situation, including children, the Roma population that Anna mentioned earlier, and that air pollution deepens these health inequalities that are already existing.
So the possible interventions could be in three domains: support to increase energy efficiency, support to payment of bills. Obviously, this is less valid for the procurement of fuel wood, but still possible, and awareness raising and capacity building. Key challenges, in my opinion, are targeting, design of measures, and financing. What we firmly believe that there is a strong need for capacity development and continuous direct technical support at both central and local level.
So we need to make sure from the onset of the formulation of investments that we provide inclusive and just responses, as well, of course, as quality assurance mechanism. We cannot sacrifice quality to speed. I think we have to find the right balance. Air pollution is another big opportunity to introduce social governance and technological innovation.
Introducing technical solutions such as improvements in the mandatory building codes for energy efficiency, energy saving, improvements in the heating, ventilation, air conditioning standards and labeling, as well as improvements in the insulation of windows, rooftops, maintenance of the existing heating equipments, efficient solid fuels. These will be critical.
How to better get the health argument forward through consolidation of the scientific evidence on the health impacts of air pollution, development of different methods and tools, efforts in capacity building, and promoting and being part of these multi-sectorial, multi-stakeholder activities and advocacy.
Our focus as international partners should be basically on delivering some innovative solutions that could be replicated. And then what is really missing in the field is focus on measurement and verification.